I'm a neonatologist. I currently work in Kansas City, Missouri, and I've been attending out of fellowship for about 9 years.
Can you talk a little bit about how you got into medicine and if you were at all inspired by a woman to enter the field?
My mother was a nurse, so I was always kind of around the field of medicine, saw her in medicine. And so when I started to have an interest in being in medicine, pursuing a career in medicine, she really encouraged me and also had some contacts that helped me kind of get some experience before going to undergrad. So I was able to kind of see what that world was like from a perspective that wasn't a nursing perspective. Shadowing a lot of physicians that she knew, she felt like it was really important for me to kind of go into it eyes wide open and have a good understanding of what that might look like for me. And so she was really instrumental in, helping me kind of know what I wanted and have a sense of what that might look like for my future.
What do you think it means to be a woman in healthcare today?
So I think it's both challenging and rewarding. I think aside from being a mother, it's probably, the most rewarding part of my life. But balancing being a mom and having a family with that job is also very challenging, as well as just the challenges of, practicing medicine. So I think women in medicine today, and always since, the first woman who went to medical school back in 1848, I think they've always been juggling and challenging things, but it's certainly, I can't imagine doing anything else. And it's very fulfilling.
What are some of the challenges of being a woman in healthcare?
I think obviously, balancing whatever your home life looks like. And I think that's true for both men and women who have challenging jobs outside of the home. But from my experience, I think that women, even when they come home, they often are still the main kind of keepers of a lot of home activities. And so they have a full-time job a lot of times outside of the home and then come home to kind of keep that together, even if their spouse is supportive and helps with that. It's still a lot. So that is challenging. I think, there's obviously other challenges to being a woman in medicine. I get mistaken. My role gets mistaken a lot. So I'm in a field, luckily, where there are a lot of women. And I think, at least in my practice, we're predominantly women, but we still get mistaken for a nurse role or another role often. And patients don't often know sometimes that we are their medical provider or their physician. So that sometimes is challenging.
On that note, what are some of the positives that come from being a woman in medicine?
I think, we bring a different perspective to medicine. I think just having other roles maybe outside of our job, and many of us being primary caretakers for other people, we bring a different perspective. We bring our empathy, our compassion, and that's not to say that men don't do the same thing, but I think there's actually been studies that have shown that if you have a woman physician, there's less readmissions, probably even a little bit better mortality data. So I think there is potentially a difference in having a woman as your physician and beneficial. I think the positives of being a woman in medicine right now are, being able to bring that to our patients and also to be there for our peers, other women in medicine as well.
What advice do you have for women who may be applying to medical school or are entering the field for the first time?
So I think one of the most important things for women who are just entering the field, something that my mom encouraged me to do and that was really helpful for me, is to find a mentor, whether that be a male or a female, but someone who can really kind of guide you and be a sounding board to you as you go through the process, because it is a process. And then even once you're through medical school and a practicing physician, I have many people in my life that I turn to when I have questions, either clinical or personal, that I just need help kind of finding my way through. So I think having a mentor is really key. I think always believing in yourself, even when you feel like you're getting a lot of no's, whether that be for medical school or promotions or research grants or whatever that may be, just always believing in yourself, knowing that if you just keep going toward that goal, you can achieve that goal, and never underestimating kind of the importance of your voice and your perspective, and knowing your worth. Those are all things that I think are really important to know.
How do you think women physicians can best support fellow women physicians?
I think being a mentor. So if you are in a practice where you have residents or fellows coming up or early career physicians coming up, I think putting yourself out there to be a mentor to them is really important. I think being transparent about your journey, what worked, what didn't work, and sharing the ways that you felt like were important to succeed. I think sometimes we feel like we're a bit in competition with other people, particularly through medical school and residency and fellowship. And I think putting that mentality aside and really trying to support one another and be transparent, because I think when one woman succeeds, we kind of all succeed, and we're all here because of women who have come before us and women who are blazing new trails now. So I think being really transparent about how to succeed with one another, and less competitive.